Hi, this is Dr. Robert Garmong, philosopher and educator, coming to you once again from my slightly more professional studio here in Dalian, China. It's been a little more than a week since I've posted, and I've made a few minor upgrades to my recording space. Hope it's a little easier on the eye. Now, I've argued that the COVID-19 virus should be referred to as the Wuhan virus because it is conditions unique to China that gave this virus fertile ground to get started and to spread rapidly. Chinese dietary practices reinforced by government policies encouraging trade in wild animals. Chinese norms of food safety, sanitation, personal hygiene, all combined to get the thing started. The incentives for short-range thinking and self-blinding that are inherent in authoritarian and totalitarian states virtually guaranteed that it would become entrenched and spread before anyone took initiative to combat it. China's newfound prosperity, fueled as it is by migrant workers, who now have become the world's largest annual mass migration, pretty much guaranteed it would spread throughout the country. China's role in the world economy, with people coming and going frequently from all around the world, provided the vector for it to leap borders and become a true pandemic. For all these reasons, China owns the origins of this virus. Now, that's not racism, and it's nothing inherent in being Chinese that created these facts. These are all things that are, if you will, accidental to China. And indeed, Chinese food practices in particular have improved steadily in the 10 years that I've lived in this country. Chinese people don't want these things to happen, and they certainly don't want the international embarrassment when they do. When someone in Boise stays away from a Chinese restaurant because somehow they're going to get coronavirus from exposure to Chineseness. Now, that's racism. What I'm doing is naming facts that truly caused the epidemic in China. So, if the rest of the world had acted as it should have, geared up properly and made sure that they were ready to stop this virus when it did reach their shores, as it inevitably would, then I would have gone to my grave referring to this as the Wuhan virus. But a funny thing happened on the way to pandemic. First of all, the Chinese national government. Once the epidemic became unevadable knowledge, the central government in Beijing reacted aggressively to shut it down. They imposed a policy of quarantine to be implemented with some legitimate local decision powers, but based on directives from above. And if anything, local discretion more often than not tended toward over-aggressiveness rather than corrupt laxity, because no one wanted to be responsible for the next new cluster of cases. Beijing threw massive resources into building healthcare capacity in a way that only China can do. And of course, you've probably seen the pictures of the instant hospitals. Doctors were sent from all over China. Travel all over the country was severely restricted. Businesses were closed by law. And it worked. For days now, there have been no new indigenous cases in the entirety of China outside of Wuhan. And even in Wuhan, the number of new cases has been extremely small, fewer than 10 per day, according to Reuters. Outside Wuhan, the only new cases have been from people coming to China from overseas. In other words, China is now safer than Italy, the UK, the United States, and a lot of other parts of the world that were smugly looking down on China just a few weeks ago. None of this erases the fact that it was China's system that caused the rapid spread of this disease in the first place. And of course, many people have argued this whole thing was overkill, that the risk of the disease didn't merit the draconian steps that they took to clamp down on it. Well, I guess we will see soon enough, because the rest of the world has now set up a perfect controlled experiment with every one of you, every viewer of this video who does not live in China, as the control group. So I guess, thank you. Because virtually the whole rest of the world has responded in the exact opposite of how you should if your goal is to prevent a pandemic. Now, let me be very clear about what they have and haven't accomplished in this country. What China did has not wiped out the virus. They could have had they acted swiftly in December in Wuhan. But once it had spread widely within that city and then throughout China, the best they could do is to let it run its course with the minimum amount of sickness and loss of human life possible. And that is what they seem to have accomplished with amazing effectiveness. But China doesn't control the rest of the world. By the end of January, the rest of the world was essentially in the same position as Wuhan had been in early December. There was a virus, they knew it was spreading, and there was essentially one source, one cluster. If anyone had paid attention to the lessons of Wuhan, they would have done two key things: identification and containment, or to use WHO's terms, early recognition and source control. Now, a third step in dealing with a pandemic, treatment to make patients non-infectious, is not yet possible with this particular virus. We have treatments, of course. We can give oxygen, IV fluids, and antibiotics to prevent secondary infections. But there's nothing yet. There's no vaccine and there's no antiviral that's yet been proven to actually kill this virus, except for the good old human immune system. So the first step would have been to closely monitor anyone who'd had contact with that initial cluster. Isolate them if possible. Be on the lookout for signs of the infection. The minute they show signs, you do what epidemiologists do. Track all their contacts, isolate them as much as possible, observe them, and repeat as necessary. As far as containment, the U.S. government actually did more or less the right things at first. On January 17, the CDC sent more than 100 people to monitor flights arriving from Wuhan at 3 different airports. And a few days later, Dr. Nancy Messonnier of the CDC warned that, quote, "we do expect additional cases in the United States and globally," end quote. However, the president and his defenders were already on the offensive, with Trump claiming, "we have it totally under control. It's just one person coming from China. It's going to be just fine." End quote. And the right-wing media had his back, with conspiracy theories claiming that Dr. Messonnier was trying to get at Trump by exaggerating the threat from the coronavirus. Now, despite Trump's own dismissing of the virus, by the end of January, the U.S. had blocked foreigners who had been to China from entering the U.S. and imposed a quarantine on U.S. persons who had been to China. Now, this was the right thing to do. It cannot have stopped the virus, but it did give us some time. According to the journal Science, a travel ban from Wuhan couldn't totally stop the transmission of the disease for various reasons, including the fact that it had already been coming from asymptomatic carriers before the ban was in place. According to the model they developed in Science, the travel ban is estimated to have bought the U.S. about 2 weeks, to the middle of February, which is not an insignificant amount of time if other measures had been taken, which unfortunately they were not. You see, containment only works if you know whom to contain. In the case of SARS, this was relatively easy because the only people who were infectious were those who showed symptoms of the disease. This new coronavirus, on the other hand, is not quite so polite. It can get you even before its host is showing symptoms, and even in some cases where the host never shows symptoms or they're so slight as to be missed. Technically, these are known as pre-symptomatic and asymptomatic carriers. Even if the whole rest of the world had completely closed their borders to everyone from China or who'd been to China, it would have been too late. The virus had already been spread by people who didn't know they had it. In other words, identification precedes containment. In some previous epidemics, we could kind of collapse these two because identification was relatively easy. But in this case, identification was the hard part. That means the number one priority has got to be to get a test ready in quantity before large numbers of cases begin to develop. That's the only way you can tell who's got the thing and therefore needs to be in containment. And the thing is, The US CDC and the WHO knew this full well back in January. So there is no excuse for anyone not to have made this the top priority of the US government as far as dealing with this health emergency. And yet we still don't have adequate testing as of the time of this recording, only promises. Now, the CDC released a test in early February, sending out a whopping 90 to state and local hospitals on February 6th and 7th. Now, mind you, this was a time when there weren't very many known cases in the U.S., but they should have known better. But it doesn't matter anyway because the test turned out to be flawed by some unspecified manufacturing defect. Now, that test was supposed to be replaced, but it never was, even as President Trump claimed that there were plenty of perfect tests, and Mike Pence promised 1 million tests would be released. The CDC and local labs finally began releasing based on a new test, doing significant amounts of testing around the 1st of March, fully a month after the first U.S. case. Too slow. And as of March 12th, the CDC reported that roughly 16,500 tests had been received for evaluation in total. That's between the CDC and 3 local labs that could do the test. Now, by comparison, you say, well, that sounds like a pretty good number. Well, let's look at a graph that charts the number of tests per million population in 7 countries and 1 province. The U.S. has tested 5 people per million total population as of March 8th. So that number would be slightly better by now, but not much. Japan, by comparison, the next worst, has tested 66 per million population, fully 13 times as many, if I'm doing my math correctly. The UK has tested 347 per million. Netherlands, Israel, Italy has tested 826 per million. Guangdong, China has tested, that's a province in southern China that includes Shenzhen and Guangzhou. They've tested 2,820 per million. South Korea takes the prize with 3,692 per million. So that makes that 5 per million look pretty pathetic. And Dr. Michael Mina, an epidemiologist at Harvard University, said, quote, "The incompetence has really exceeded what anyone would expect with the CDC. This is not a difficult problem to solve in the world of viruses," end quote. And yet, we have failed. Now, as the government has failed to act, it has also grossly failed to communicate. One day the president tells people it's nothing and will quickly go away. Next day he declares a state of emergency. A travel ban for everyone coming from Europe, and he did say everyone, sent Americans in Europe scrambling to buy plane tickets because they didn't know when they would get to come home if they didn't go immediately. Reportedly, some people paid up to $20,000 for a single coach ticket, only to learn that the travel ban doesn't apply to U.S. persons. People don't know whether to laugh off the disease or stock up on toilet paper, of all things. This kind of uncertainty costs money, hurts the economy, and ultimately costs lives. What's more, the rest of the world desperately needed U.S. leadership, very much needed U.S. leadership to avoid its own inanity. Lacking that, the nations of Europe have become breeding grounds. Italy, first reported cases on January 30th to tourists from China. On February 22nd, they had the first death in Italy, and the case number stood at 20. On the 23rd, the very next day, the cases surged to 79, and a day later, it was up to 229 with 7 deaths. That same day, 50,000 people in 3 towns were put under quarantine. But it was too late. By that time, Italy had become Europe's first major source of community spread of the infection. Other countries began banning Italians from entry, although interestingly, the UK never did, as far as I know. Certainly not at that time. On March 8th, northern Italy locked down, closing all their museums, ski resorts, cultural centers, swimming pools, basically any public space. 16 million people were affected. But again, it was too late. 5,883 cases had already been reported with 233 fatalities. On March 9th, there were prison riots that killed 6 inmates. And in another jail, the inmates took guards hostage. I never saw what ended up happening with that one. By March 12th, which is the latest that I've been able to find data, there have been 1,016 deaths and a total reported cases of 15,113. In Italy, there are reports of hospitals that are massively overwhelmed by this huge surge of cases. And Lombardy, the northern part where this was centered, is known for having some of the best hospitals in Europe. So we're not talking about some backwater here. And nonetheless, doctors have reported having to perform literal triage in the original sense, where they're not just saying who gets treated first, second, and third. They're looking at who gets treated and who just doesn't, because we don't have the resources and they're simply left to die. It's horrible, grim situation. Now, a similar path of denial and sluggishness can be traced in the UK, where flights from Italy were still landing last I heard. They may have finally stopped it by now, but again, way too late. And numerous other European nations are just now starting to catch up. And they are going to struggle just as China did and just as Italy is. One UK health minister said that they estimate they're about 1 month behind Italy. So they're going to be in the same situation a month from now. So for all the above reasons, by the power vested in me by absolutely no one at all, I hereby declare that, as far as I'm concerned, this is no longer the Wuhan virus. It is now the property of the world. Now, origins matter, and it is important that we assess rationally where this came from and why. That's why I insisted on calling attention to the origins of this virus in certain aspects of Chinese culture and the Chinese system of government in particular. And when all this is over and done, and we can start putting the pieces back together again, I hope political correctness and the fear of offending Chinese sensibilities will not blind us to these facts. However, the rest of the world, and especially the United States of America, is now just as much to blame for the fact that this has become a pandemic, which it didn't have to be. It didn't have to be. So on that high note, I thank you once again for watching. I'm Dr. Robert Garmong. Please don't forget to hit like and subscribe, and recommend this video to your friends if you are so inclined.